Henrico Doctors Hospital failed to consistently implement methods to prevent and control the transmission of infections within the hospital. That's according to inspectors with the Virginia Department of Health's Office of Licensure and Certification. The findings relate to an outbreak in the neonatal intensive care unit of MRSA, an antibiotic-resistant infection. In January, a hospital employee told the state the outbreak had been ongoing for over 3 years, and the facility had not determined the cause. State inspectors found a hospital document that said 94 NICU patients had contracted MRSA between the start of the outbreak and early November of 2024. An infectious disease doctor in another part of the state tells me that at their hospital, they typically see 5, maybe 10 MRSA cases a year in the NICU. That doctor, who has asked to remain anonymous, says they feel the CEO of Henrico Doctors should have shut down the NICU for a period of time so that it could have been completely disinfected. Helen Haskell, who is on the leadership committee for the nonprofit Patient Safety Action Network, called the number of MRSA infections in the Henrico Doctors NICU excessive.
I think it is a shocking number of infections, and I think that it shows a very poor culture of infection control.
During the inspection, the State Watch staff entered the room of a NICU patient with MRSA who had been exposed to another infection called RSV. A staff member said all staff and visitors should wear a gown, mask, and gloves when entering that patient's room, but inspectors observed one staff member wearing no personal protective equipment and said they then left the room without performing hand hygiene before entering another infant's room.
MRSA and other infections are controlled by process. You have to have adequate staffing, you have to have well-trained staff, and you have to have attention to infection control process and to environmental services, to environmental cleaning.
Henrico Doctors Hospital is at the center of an investigation into NICU babies with broken bones, and much of this 97-page report focuses on failures identified in relation to those incidents, but it also addresses the MRSA outbreak, which CBS 6 first asked the state about in late January. At that time, spokeswoman Maria Reppes said VDH was declining to release any information on the outbreak based on a state code that says VDH is required to preserve the anonymity of patients and practitioners whose medical records are examined during the course of a disease investigation.
Do you think that the public deserves to know about outbreaks like this?
Yes, until you have everybody knowing what's going on, there is simply too much of an incentive to sort of let it go, get used to it.
In its plan of correction, Henrico Doctors Hospital, which is owned by HCA, said in February a multidisciplinary team created a scorecard to monitor all actions taken to reduce the spread of MRSA in the NICU. They stated this plan effectively tracks all infection prevention activities, implementation strategies, and progress toward improvements. It includes hand hygiene non-compliance being immediately addressed. The hospital said that during a 12-week surveillance period that was monitored by VDH and ended on February 22nd, there were no hospital-acquired MRSA cases in the NICU. We requested an interview with somebody from HCA to talk about the MRSA outbreak. A spokesperson declined. In Henrico County, I'm Melissa Hippolyte for CBS 6.